COVID-19.
Thank you, Mr. Speaker. Our race between the vaccine and the virus continues. As a nation, we've taken some huge strides forward, Mr. Speaker. There are now 908 people in hospital with coronavirus, a fall of 9% in the past week, and the average number of daily deaths is now 6, the lowest number since the middle of March. On top of this positive news, Mr. Speaker, our vaccination programme is accelerating at pace. Over 72% of all adults have now been given their first dose, and 43% of all adults have the protection of 2 doses. And this weekend, we reached the milestone of 60 million vaccines administered across the United Kingdom. Mr. Speaker, this weekend, Public Health England also published new research showing that the effectiveness against symptomatic disease from the variant first discovered in India is similar after 2 doses when compared to the B.1.1.7 variant dominant in our country. And that, as with other variants, even higher levels of effectiveness are expected against hospitalisation and death. This is encouraging data, Mr. Speaker, and it reinforces once again the importance of our vaccination programme in giving us a path out of this pandemic, as well as showing just how important it is that everyone comes forward for both jabs when the call comes through. Mr. Speaker, it's the progress made by the British people in following the rules and the protection offered to our vaccination programme that means we were able to take step 3 in our roadmap last week. But we take these steps with vigilance and with caution, staying alert to new variants that can jeopardise the advances we've made. We've come down really hard on the variant first identified in India, wherever we have found it, surging in testing capacity and vaccine for those who are eligible. Over the past few days, we've extended this rapid approach to even more areas. So as well as Bolton and Blackburn and Darwin, which the Prime Minister spoke about at his press conference on the 14th of this month, we are taking rapid action in Bedford, Hounslow, Burnley, Leicester, Kirklees and North Tyneside. As the Prime Minister set out 2 weeks ago, we're urging people in these areas to take extra caution when meeting anyone outside their households or support bubble, including meeting outside rather than inside where possible, keeping 2 meters apart from people you don't live with, and that people should try to avoid travelling in and out of the affected areas unless it is essential. For example, obviously for work, if you can't work from home, or for education. As the Prime Minister said, Mr. Speaker, we want the whole country to move out of these restrictions together, and we're trusting people to be responsible and to act with caution and common sense as they have done throughout this pandemic, and to make decisions about how best to protect themselves and their loved ones, informed by the risks. That is exactly what we should be doing. We're always looking to see how we can communicate more effectively with local authorities, and we will, of course, take on board the views expressed by the House over the course of this debate. Mr. Speaker, through acting quickly whenever the virus flares up and protecting people through our vaccination programme, we can guard the incredible gains we've all made and get ourselves on the road to recovery. Thank you very much indeed.
Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker. Does the Minister appreciate that cities like mine in Leicester, or towns and boroughs like Burnley or Bolton or Batley and Blackburn, borne the brunt of this crisis these last 15 months? We've often been in lockdown longer than elsewhere. At times we felt abandoned. We didn't have adequate financial support. Families did their best, but they struggled. So can the Minister understand how upsetting it is? Can he understand how insulting it is to have new restrictions imposed upon us, local lockdowns by stealth, by the back door, and the Secretary of State doesn't even have the courtesy to come and tell us? Why was this guidance plonked on a website on Friday night and not communicated to everyone? Why were local directors of public health and local authority leaders not consulted? Why weren't MPs informed? And what does it now mean for our constituents? What does it mean for the family in Leicester who are booked a few days next week by the coast for school half term, do they have to cancel that break? What does it mean for university students in Leicester when they finish their exams? Do they have to go home? Or can they go home? And can prospective students come and look at the campuses? What does it mean for the parents in Bolton who are planning to take their children to see grandparents on the other side of Greater Manchester this bank holiday Monday? Should they rearrange their plans? What does it mean for the young couple in Burnley or Blackburn or Batley who have postponed their wedding for over a year and have invited friends and family from across the country to come and celebrate their special day with them? Is the message to them that they have to delay their wedding again? Can the Minister answer these questions today? And can he take a message from me as the Member of Parliament for Leicester South back to the Secretary of State? Withdraw this guidance now and convene a meeting this afternoon of the relevant directors of public health to produce a plan involving isolation support, enhanced contact tracing, and because he knows from his own work as vaccines minister that a single dose of the vaccine is less effective against this particular variant, will he produce a plan with local directors of public health to roll out vaccination to everybody and look at including bringing forward the second dose for a larger cohort of people? Now, Mr. Speaker, in closing, a year ago, ministers like him were defending Dominic Cummings on Twitter. Now Mr. Cummings tweets about the lack of competent people in charge. Well, many of our constituents, looking at this latest lockdown fiasco, will think that Mr. Cummings has a point.
Thank you, Mr. Speaker. I thank the honourable member for his, I hope, equally supportive comments when it comes to supporting his constituents and others around the country in Bedford and Blackburn and Bolton and Burnley and Kirklees, Leicester, of course, his own patch, and in Hounslow and North Tyneside. The one thing I would urge, and I spoke to the Metro Mayors this morning, the M10 Metro Mayors, is that we all work together and take the politics out of this. I think our constituents deserve that. Essentially, as I said in my opening statement, what we're asking people to do in those affected areas is to be cautious, is to be careful. So on visiting family that he asked about, meet outside rather than inside where possible. Meeting indoors is still allowed in a group of 6 or 2 households, but meeting outdoors is safer. Meet 2 meters apart from people you don't live with unless you have formed a support bubble. This includes obviously friends and family you don't live with. So yes, people can visit family in half term if they follow social distancing guidelines. The guidelines include specific sections on meeting friends and family. Avoid travelling in and out of the affected areas, as the Prime Minister said on the 14th, unless it is essential, for example, for work purposes. The whole principle here, Mr. Speaker, is that we need to work together. He has a responsibility, as I do, as do the Metro Mayors, to communicate to our residents, our constituents, that this is a time to be vigilant, to be careful. We're putting more surge vaccination and, of course, surge testing and turbocharging vaccination, I should say, in those areas to make sure that we do the work with local directors of public health. And absolutely, I hope he will agree, we've had that plan in place. We've seen it operate in Bolton and Blackburn, and we'll see it operate in his constituency in other parts of the country as well.
Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. Can I congratulate the Minister for the outstanding rollout of the vaccine programme, which is a source of enormous pride to all of us on all sides of the House. As we emerge from lockdown, we all want it to be a permanent change. And for most families, the biggest priority is to make sure that schools remain open, even if we find that new variants arrive in the UK in the course of the autumn. We know that children don't tend to get bad symptoms, but they can spread the virus. So is it time to look at vaccinating the over 12s, as they are doing in the United States? Is it time to look at whether we can use some of the FDA analysis to speed up that decision-making process so that by the time children come back in the autumn, schools are protected and we can be confident they'll be able to stay open?
I'm grateful for my right friend's question. I think he's absolutely right to focus on the protection of children, but also of families and their community. And that clinical decision has not been taken in the United Kingdom. he will be aware, as well as the US regulator, the Canadian regulator has approved the Pfizer BioNTech vaccine for 12 to 15-year-olds. We will operationally be ready, but ultimately the decision has to be a clinical one, and our regulator will have to be satisfied that the vaccines are extremely safe, because when you're vaccinating children, where essentially you're, yes, offering some protection to them, and of course children can be infected with COVID and have some evidence of long COVID amongst children, but on the whole, it is really to protect their families and transmission in communities. The vaccines have to be incredibly safe before we administer them to children, but we have the infrastructure in place to be able to do that as and when that regulatory and clinical decision is made.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thank you, Mr. Speaker. Can the Minister explain, if these new restrictions for areas like Bolton are only advisory, will hospitality companies affected still be eligible for financial support? And why the Public Health England report on variants was snuck out at 11 p.m. on Saturday during the Eurovision final and minus the promised data on school outbreaks. The B1617.2 or April 02 variant appears to be 50% more infectious and is affecting even younger children. So can the Minister explain why on earth the government ended the wearing of face coverings in schools? While it is good that 2 doses of the vaccines still provide good protection from this variant, testing shows 1 dose is only 33% effective. The gap between doses has been shortened from 12 to 8 weeks, but with less than half of those between 50 and 65 years of age having had their second dose, are there plans to close the gap further?
Grateful to the Honourable Lady's question, and I would just remind her that Public Health England make those decisions for themselves and not up to the Minister when they actually release their data. On pubs and hospitality, indoor areas of venues, whether it's cafes, restaurants, bars and so on, can reopen, and any premises serving alcohol, customers will still be, of course, required to order and be served and eat and drink while seated. Venues are obviously prohibited from providing smoking equipment such as shisha pipes and so on, really just to make sure that we do everything we can to limit the ability for the virus to infect others, and to, within that, reducing that social contact is incredibly important. Some businesses, of course, such as nightclubs, must remain closed and follow restrictions. And so it really is very much about making sure that we work together to control this B1617.2 variant, exercising that common sense that the Prime Minister spoke about, and the guidance is there to do that. And people on the whole have been following that guidance. Of course, on transmission and the effectiveness of the 2 doses, and her question around accelerating the vaccination programs, the whole idea of us following the JCVI guidelines and advice on vaccination is we've been able to vaccinate at scale. We've got 2 big weeks coming ahead of us, and we'll continue to focus on the second dose. So when people get that text message or the call to bring forward their second dose, please take that up. It's incredibly important in controlling this variant.
Greg Smith.
Thank you, Mr. Speaker. It's tremendous news that the vaccines that are being so successfully rolled out across our United Kingdom are highly effective against the variant first identified in India. But many businesses continue to be delicately balanced on a cliff edge of either a successful summer or bankruptcy. So does my honourable friend agree with me that we need a positive message of hope and certainty, that all the evidence does continue to back up the complete end of all restrictions and social distancing by the 21st of June?
I'm grateful for my honourable friend's question, and it is good news from Public Health England on the B1617 variant, that the 2 doses of either Pfizer or AstraZeneca Oxford are as effective on infection, and very likely to be even more effective on serious illness and hospitalisation in real-world circumstance. ultimately, we are effectively pursuing a evidence-led strategy. The reason for the 4 weeks plus one, the 5-week interval, is for us to be able to assess the data and then share it with Parliament and with the nation. At the moment, I would say I'm cautiously optimistic that we are in a good place. We have to remain vigilant. We have to work together. As I said earlier, take the politics out of this and let's make sure all of our constituents are careful and we'll get there together.
John Spell.
Thank you, Mr. Speaker, and I'm sure the Minister will agree that throughout the pandemic, our community pharmacies have performed magnificently on the front line of the health service. But unfortunately, there still seems to be institutionalised bias against them in the health department. Even now, only a couple of pharmacies in Sandwell have been authorised for COVID vaccines. So, Minister, can I urge you to get a grip of your bureaucrats and get vaccines rolling through our Sandwell pharmacies and before the bank holiday?
I'm grateful for my honourable friend's question. I know he's a passionate advocate for community pharmacy, and he and I have discussed this in the past. I don't recognise his characterisation of the NHS team that I absolutely know every day work with community pharmacies. We are now up to, I think, just over 500 community pharmacies and independent pharmacies actually as part of the vaccine deployment. We know, and they proved themselves in phase 1 to be excellent at reaching out to their communities, giving that confidence to their communities and getting people vaccinated. And they've stepped up in phase 2 as well to fill the gaps where primary care has decided not to carry on with phase 2. So we keep going, and I will absolutely look at his constituents to see whether we can do some more.
Sean Bentley.
Thank you, Mr. Speaker. Mr. Speaker, the record vaccine rollout has absolutely vindicated the decision of my constituents in Wednesbury, Albury and Tipton to believe that this country can actually succeed in terms of standing on our own 2 feet. But, Mr. Speaker, vaccination is going to form a really big part of our lives going forward. Can I ask my right honourable friend what work he's doing around localised infrastructure going forward to ensure that as we have to continue our vaccination rollout, we have the localised infrastructure to do that and to ensure this great progress isn't hindered?
I absolutely agree with my own friend. If the virus was designed to test liberal democracies, because the only way we could combat it was to withdraw people's freedoms with the dreaded non-pharmaceutical intervention, the MPIs, then the vaccine has played to the real strength of the 4 nations that make up the peoples of these isles, in the sense of that Dunkirk spirit coming together, 1,000 flotillas, you know, the volunteer vaccinators, 80,000 of them, the doctors, nurses, pharmacists, and of course our armed forces and our local government colleagues who've not only stepped up in terms of identifying communities that we need to protect, but also finding those sites. So we are already making plans for the booster jab and be ready by September. The clinical decision hasn't been made as yet, I would remind the House, but when it is made, whether it's September, October, November, or early in the new year, we'll be ready to go. And we're also planning as to how it dovetails with our flu vaccination programme, and to see how we can increase the uptake of the flu vaccination programme, because the worst of all worlds is you do well against COVID and then you're hit by a heavy flu season in the autumn.
Let's go to Mohammed Jassim. Mohammed.
Thank you very much, Mr. Speaker. Last evening, I learned the government had sneaked Bedford Borough into local lockdown without even bothering to warn the public health team. Minister knows that for almost 2 weeks, I have been calling for surge vaccines in Bedford for all over 16s. Yet until last Friday, many of my constituents have been forced to travel miles to access Pfizer vaccine. The variant first identified in India has been imported here because of the government's lax approach to border control. So can I ask the minister why the people of Bedford are paying for his government's gross negligence and incompetence once again?
I'm grateful to the honourable member. He and I discussed the turbocharging of the vaccination programme in Bedford, which I know that he appreciates. The real difficulty is if you begin to vaccinate people that are 18 years old now and outside of the Joint Committee of Vaccination and Immunisations advice, then you're taking vaccine away from others who are eligible and need that protection. So the strategy we're pursuing is to turbocharge. And I need to explain that a little bit, Mr. Speaker, in the sense that we are effectively putting more resource, later opening, mobile vaccination centres, expanding vaccination centres, so that those who are already eligible and for whatever reason have been unable to access the vaccine or have been waiting to see can get that protection of the first dose, and of course then get the second dose into all those over the age of 50, because the 2 doses we know in those areas against that B1617.2 variant make a huge difference.
Jacob.
Thank you, Mr Deputy Speaker. I congratulate the Minister on the success of the vaccine rollout and the rate at which the age limit is now dropping. And at the age of 28, I'm regularly checking the NHS website when it's my turn. However, those who are a little older than me are currently trying to get their first jab at the Riverside Stadium in Middlesbrough, but struggling to get the jab, reportedly because they're only stocking the AstraZeneca jab at the vaccine centre there. Can the Minister use his office to try and find out what the problem is, resolve it, so that people aren't having to travel unnecessarily to get their first jab?
I'm grateful for my honourable friend, and I will absolutely look at what the issue is, because the good news that we've had recently from our regulator, the MHRA, is that on the Pfizer-BioNTech vaccine, it can now be stored for up to a month. It used to be only 5 days once it's thawed from -70 degrees centigrade, and therefore it is much more versatile and less challenging than it used to be. So I will absolutely look at that and write back to him and contact him.
Munira.
Very much, Mr. Speaker. One of the areas of concern for which new restrictions have been published but no advice has been communicated is the London Borough of Hounslow, which shares a boundary with Whitton, Hampton and St Margaret's in my constituency. Hundreds, if not thousands of people go back and forth every day for school, for work, to get food and other essential supplies and for medical appointments. So could the Minister firstly advise my constituents whether they should be getting on buses and trains which cross the borough boundary, whether they should be going to supermarkets and accessing medical services over the borough boundary? And secondly, will he consider vaccinating as a priority people who have to go to work, teachers, key workers, airport staff in Hounslow but live outside the borough?
I'm grateful for the honourable lady's question. I discussed this with the Mayor of London this morning. Of course, Hounslow is on the list of affected areas, and we are turbocharging the vaccination programme as well as surge testing and the sequencing and isolation. But as I, in response to others, have outlined, that people need to exercise that caution, that common sense, only travel if it is essential outside of the area. That is important, and the right thing to do is for us to work together to make sure we deliver that message, as I did this morning with the Mayor of London.
Mark.
Thank you very much, Mr. Speaker. In the Telegraph story this morning about what the rules for self-isolation might be post the 21st of June, a government source was quoted as saying, in response to the suggestion they won't change, that there's still a risk of spreading the virus and catching it. Now, that is, of course, true. There is a risk. But, of course, once people have been vaccinated, the risk is much lower. And, importantly, the vaccines are very effective at stopping serious disease, hospitalisation and death. So can I say to the Minister, post the 21st of June, it's important not only that legal restrictions go and social distancing goes, but all of the remaining rules are adjusted to reflect the much lower risk that exists once we've vaccinated the population. Otherwise, we're going to have those rules in place forever.
I'm grateful for my right honourable friend's question. I think it's worth waiting until the 14th of June when we will be saying more on this. Suffice to say 2 things. One, even if you've had, and I've had this experience in my own family, 2 doses of either vaccine, you still can actually contract COVID, and therefore you should be isolating and quarantining. We're also looking at ways that contacts of people who may have contracted COVID can be regularly tested instead of isolating.
Let's go to Jim Shannon.
Can I thank the Minister for his responses so far and the magnificent effort. I had my second vaccine yesterday, just to show how national that was. The person who carried out that injection was a doctor from Lincolnshire. So it very much shows, I believe, that the United Kingdom of Great Britain and Northern Ireland works better together. And that's a supreme example of it. We understand that things will change depending on the circumstances, and localised lockdowns may be the way to do this to ensure that areas who have low numbers are able to allow people to safely live. But can the Minister outline what parameters establish localised lockdowns, and if this is the same approach that will be taken UK-wide by devolved regions. Thank you.
I'm grateful for my honourable friend's question. I'm very pleased to hear that he's had a second dose, and when you do get that text message, please come forward and have your second dose. We're looking to make sure that the whole country comes out of this together, hence why the advice is very much about exercising caution and self-responsibility. People actually get this, and you see it in much of the data from research, that they know what are the things that can add to the risk, and therefore should abstain from doing those things whilst we vaccinate at scale and get to that place where we can all hopefully get our lives back.
So Desmond.
Opposed to the use of COVID passports in the domestic economy. When will the government set out its proposals in some detail?
I'm grateful to my right honourable friend's question. We are considering a range of evidence around, obviously, COVID status certification and whether it may have a role in opening up higher risk settings. So it would be remiss of a government minister or a government not to look at technologies around the world that would allow us to open up not 20% of Wembley Stadium for the FA Cup final, but the whole of Wembley Stadium. No final decisions have been made, Mr. Speaker. We will, of course, are committed to setting out our conclusions of the review ahead of step 4.
Andrew Singh Desi.
Very much, Mr. Speaker. Some people have been making a lot of money from government-approved quarantine hotels, but many of my Slough constituents are continuing to suffer during their stay. In a long list of angry complaints is a lack of water, with people being told to drink from the bathroom tap, a lack of water, also with the food as well, the poor food standards, often not meeting dietary or religious requirements, and people having to once again fork out on takeaways, poor ventilation with no chance of opening a window. And I haven't even started yet on the shambolic state of mixing in hours-long airport queues. So even if somebody doesn't have coronavirus, they soon will have. So, Minister, why is the government failing to get a grip of the situation despite repeated requests from right honourable members of this House?
Thank you very much, Speaker. I'm grateful for the honourable member's question. I don't recognise his description of the way the system is working. There were some, obviously, distressing videos posted online of people in airports, but we work with the airports, and we require airports to make sure that social distancing protocols are followed. Indeed, with Heathrow, we've recently looked at red list countries arriving in a particular terminal. I will take away his point around particular hotels, if he can let me have the exact details to look at what's happening, because I think that's wrong and distressing if people can't have fresh drinking water.
Tom Hunt.
In Suffolk and North East Essex, 97% of over 80s have now had 2 jabs, which I think the last time put us top of the league table. I predict that I'm on the cusp as a 32-year-old being offered my jab, but I'll wait for my contact to confirm that is the case. Huge thanks should also go for BSc Multicultural Services, who have worked incredibly hard with hard-to-reach groups to get a vaccine out. But also, I'd like a special mention here about community pharmacies, which I know another honourable member has mentioned. Aqua Pharmacy on Duke Street. It seems like a very long time ago, it first approached me. They've subsequently gone on to deliver 15,000 doses. They do sometimes feel that community pharmacy don't always get the attention they deserve. Will the Minister assure me, in the NHS white paper going forward, community pharmacy will be the heart of what we do to recover from this pandemic?
I can certainly give them that reassurance. They are an incredibly important part of our deployment infrastructure.
David Lynn.
Thank you, Mr. Speaker. Like everybody else, I pay tribute to those who are delivering the vaccine and those who have developed it. And I'm not quite at the age where I've been offered my first dose yet, but I'm hoping that that will be soon. And when I get that blue envelope through, I will go and get my JAG. But the Minister will be aware that there are a number of people who do have phobias of needles. So would he be in a position to update the House on the development of a nasal vaccine?
I'm grateful to the honourable member, and I'm glad he's going to get his JAG when the call comes. We are obviously working with a number of manufacturers that are looking at different delivery technologies for vaccines in the future. It's still some way off, I'm afraid. The needle of the moment dominates the vaccination deployment technologies, but I know a number of them are working on other ways of delivering vaccines, including pills.
Mr. Speaker, 70% of my constituency have now had one vaccine, and I'm sure the Minister will join with me in congratulating and thanking all those people in Warrington who've played such an important part in this incredible vaccination programme. As the Minister will know, vaccines are one part of the solution. I wonder if you could give us an update on drugs and research into treatment for those people that do find themselves in hospital suffering from COVID.
I'm grateful for my honourable friend's question. I join him in thanking the local team for going above and beyond. And as I said earlier, it's that the spirit of Dunkirk and the coming together of the nation to deliver the vaccination programme. The Prime Minister announced a couple of weeks ago the Therapeutics Task Force, which is moving at pace to identify therapeutics and antivirals to help those people who, for whatever reason, cannot be vaccinated, and of course to give us a greater arsenal in our armoury against this pandemic.
Let's go to Neil Hanby. Neil.
Thank you, Mr. Speaker. I get my second vaccine tomorrow, so I would also like to thank all of the NHS staff and other staff who have made this possible in such a quick turnaround. However, all of that cannot conceal the opacity of the UK government's position on accusations of cronyism and corruption. But thanks to the Good Law Project, this has finally been challenged in the High Court this week. I've been attempting to get to the heart of the procurement of unlicensed intravenous flow devices and been met with glib obfuscation from the department. Can the Minister therefore tell me, when was the contract for these devices signed? Was it known at the time that these tests were not licensed by MHRA for asymptomatic testing? Which Minister approved this contract? And if the government really has nothing to hide, why doesn't it just come clean?
I'm grateful to the honourable member's question. I would just remind him that the Prime Minister at this dispatch box announced a full inquiry that will take part in the spring of 2022, where we can learn all the lessons of the COVID pandemic and the government's response to it. Suffice to say, all contracting is published in the appropriate way, and civil servants follow the exact rules around contracting.
Richard Holden.
Thank you very much, Mr. Speaker. 57,000 people in North West Durham have had the first jab, 34,000 the second. So we're doing really well and progressing excellently. And I've got my first jab this Saturday, and I just say to my honourable friend for Ipswich, he is 32, so he can also get his jab now. And anybody else in my constituency or across the country can book now through the app. There are concerns, though, Mr. Speaker, about the vaccine, and the Minister, and can the Minister just ensure that all the possible issues and side effects are constantly monitored and published so that people can make those informed, positive choices to get the vaccine, especially in younger age groups, to ensure that everyone is as protected as possible, especially for the new variants?
I'm grateful to my honourable friend question. I can certainly give him that reassurance, because we have an independent regulator here in the MHRA and, of course, Public Health England, and we have a system called the Yellow Card System, where adverse incidents are recorded. They can be reported by your GP clinician or yourself directly, and all that data is published and people can access it on their MHRA website, and they can Google it and see it. It's incredibly part of the success story of the vaccination programme is that sharing of information, sharing of data, which has led to the highest level of vaccine acceptance in the world amongst adults. I think it stands about 90% at the moment, all adults saying they will take the vaccine or very likely to take the vaccine.
Let's go to Janet Davey.
Thank you, Mr. Speaker. What steps are the government taking to ensure the UK is a leader in the global response to tackling COVID-19, especially given the fact that we are not safe until everyone is safe?
Thank you, Mr. Speaker. Well, when the Prime Minister set up the Vaccines Task Force, he gave it two priorities. One, to discover the vaccines that will work, to contract with them, or to manufacture them in the UK. And the other priority was, how are you going to help the rest of the world? Which is why we were the first country to put £548 million into COVAX and very much established COVAX. There's now over 450 million doses, the bulk of which is AstraZeneca Oxford, which is our gift to the world. 98% of COVAX jabs that have gone out and been delivered and protected people have come from Oxford AstraZeneca. And I know Pfizer are also doing the same thing from day one. Their chief executive, Albert Bourla, spoke about vaccine equality, and they are offering to low and middle income countries the vaccines at cost as well.
Let's go straight to Rachel.
Thank you, Mr. Speaker. It's simply unacceptable that my constituents in Luton South found out about the changed travel advice to Bedford through the back door via the media last night. They need thorough clarity and formal information through our local authorities. And talking of our local authorities, can I ask the government what steps they're taking for the prioritisation of turbocharged vaccinations, not just for areas with the new variant, but those areas who have enduring transmission?
I'm grateful for the Honourable. I think I've dealt with the first part of her question in the sense that that guidance information was shared with the country on the 14th of May, and we continue to endeavour to improve our communications in partnership with local government and directors of local health systems. In terms of the vaccine turbocharging, she will know that we're looking at whether it's mobile vaccination sites, increasing the hours of opening for sites, as well as putting more resource into that so that we can actually vaccinate the people who are eligible to be vaccinated. And that's the important, I think, distinction to make. But we'll continue to do all of that in Bedford to make sure that people in Bedford are protected and we get this variant under control.
Over the weekend, I was contacted about 2 instances where people were having difficulties getting the access they wanted to their frail relatives in Barnet Hospital. This was particularly distressing because in both instances, the patients had difficulties communicating and understanding with hospital staff. I appreciate the hospitals do have to, as a paramount duty, to ensure that they have proper infection control, but will the Minister encourage hospitals right across the country to facilitate visits so that relatives can support the frail elderly whilst they're in hospital?
I'm grateful for my right honourable friend's question, and I will certainly take her specific constituents' details and look into that. But we certainly urge all hospitals to make sure that where the frail elderly and in need of that essential contact, they are able to do that.
Let's go to Mick Whitley. Mick.
Thank you, Mr. Speaker. No one is safe from COVID-19 till we all are, but the UK continues to stubbornly resist calls for a waiver of COVID-19 vaccine patents. Given that many of the world's poorest countries can't expect to be vaccinated until 2023, and the failure of the COVAX initiative to distribute vaccines at the volume and speed that is needed, will the government now follow the lead of the Biden administration and reverse its position on the patent waiver?
Thank you, Mr. Speaker. I think this is a really important question, and I would just want to share with the honourable member a little bit of the operational challenges around vaccine manufacture. And of course, we will look at any text that our US colleagues will put forward in terms of the IP issue. But in reality, if the exam question is to get more jabs in the arms of those who live in low and middle income countries, then actually it's not the IP that is the bottleneck. It is the transfer of technology to manufacturers around the world. Now, what AstraZeneca Oxford did incredibly well is to transfer that technology to 20 sites that can manufacture at scale. And we've already delivered 450 million doses of the Oxford AstraZeneca vaccine. And Pfizer did the same thing. If you recall, they actually paused their manufacturing in Europe and expanded it to go from 1.2 billion doses a year for 2021 to almost 3 billion doses for 2021. So if the exam question is to get more jabs in arms, we need that technology transfer. It's not easy. We saw it in Helix in Europe. They had great difficulty to operationalize the manufacturing, in Catalent and in the US. That is the real effort that needs to go in, as well as, of course, helping other countries in deployment. It's only one part of the jigsaw to get the vaccine into warehouses in those countries. They've got to be able to get it out and into people's arms.
We now come to Robert.
The experience over the last year has shown that local lockdowns aren't effective as cases simply rocket in the areas immediately outside of where the local restrictions are. With this in mind, and to get ahead of the curve, this morning I've been in discussions with Derbyshire County Council and my local Director of Public Health to establish a pop-up vaccination site on Gamesley, where there's been a high number of new cases, so that we can deliver surge vaccination. Will the Vaccine Minister work with me and my local Director of Public Health and the NHS to ensure we get the doses we need to get everyone in the High Peak vaccinated as soon as possible?
My honourable friend is absolutely right. The important thing is to get those who are eligible vaccinated and get those who need their second dose to get that second dose within that 8-week period, because that is the way we control this variant. And I would very happily work with him on any local initiative that he's working on.
Let's go to Stella Creasy. Stella.
Thank you, Mr. Speaker. Mr. Speaker, the evidence is clear. Women who are pregnant who get COVID are twice as likely to have a premature birth and twice as likely to experience stillbirth. Other countries have recognised this and have ensured that pregnant women of any age are a priority for vaccination. But in this country, the conversation about this data hasn't even happened yet, despite months of asking. Minister, there will be thousands of pregnant women in the areas where the variant is on the rise, as well across the country, terrified about what might happen if they get COVID. What can we do to help them get hold of the vaccine, regardless of age, so that we are protecting the youngest members of our community?
Thank you, Mr. Speaker. The Honourable Lady will know, because she's on the weekly MPs call that I host, that the Joint Committee on Vaccination and Immunisation are looking at the data on this. But in the meantime, because of the data provided from the United States of America, we've made the Pfizer-BioNTech and Moderna vaccine available to all pregnant women that are in the eligible cohort, and that is happening as we speak. But of course, Professor Antti Harandon, I know, who's Deputy Chair of JCVI, has promised her that they are looking at the data, and when they deliver the advice to us, then the system will follow that advice.
Johns.
The scale and pace at which we're delivering our vaccine programme is a marvellous achievement and a testament to everybody involved. It's how we're able to gradually and safely come out of the restrictions. So can my right honourable friend confirm that we will always be following the science and the data as we do this, so activities can be resumed as safely and as soon as possible? I'm particularly thinking about indoor gatherings for groups, such as perhaps community choirs or other events that bring people together. These are so needed to combat the isolation that has hit so many people during the lockdown.
I'm grateful for my honourable friend. He will know that the reason for the restriction around activities around choirs and singing is because of the added transmission through aerosols or droplets. But the faster we can move the vaccination programme, the sooner we can end those restrictions. And therefore, my absolute focus and my commitment to him is we continue at pace. We've got a big week this week and a big week next week.
Florence Ashton.
Thank you, Mr. Speaker. Just to thank the Minister for those weekly updates, which I found really helpful, and his work in terms of vaccine hesitancy across the BAME community. I had my vaccine on the 14th of May at St Thomas's Hospital, the same hospital that cared really well for our Prime Minister who thanked those nurses, including Louise, who gave me my vaccine. But we saw that Jenny resigned from the NHS last week. So will the Minister use his will and his power to speak to the Treasury to get our hard-working nurses the pay they deserve?
I'm grateful for my honourable friend's question and for her commitment in making sure we get the vaccine message out to the hard-to-reach communities, and her work with me on the weekly meetings. Of course, we have delivered an increase to nurses, and we await the outcome of the deliberations of the panel that will look at the nurses' pay, and then the Treasury will make the announcement in the usual way.
Thank you, Mr. Speaker. Can I thank my right honourable friend for his assistance in ensuring continuity of supply to the Baths Hall in Scunthorpe and our other vaccination hubs? We have had over 71% of our adult population in North Lincolnshire receive their first vaccine and almost 50% their second vaccine. Will he join me in thanking the fantastic volunteers who I see outside in all weathers at the Baths Hall welcoming patients to receive their vaccination? We quite simply could not have done it without them.
I'm grateful for my honourable friend, and I will absolutely join her because I see it up and down the country all of the time. I spoke about it earlier, Mr. Speaker, that Dunkirk spirit, people coming up and just saying, I want to be counted, I want to be part of this. We demonstrated it a little bit in the Olympics in 2012 to the world. This is a whole other scale of operation, but nevertheless, we've delivered on it and we'll continue to deliver on it. And I have to say, I stand on the shoulders of the real heroes and heroines of the NHS family and our armed forces and local government.
Thank you, Mr. Speaker. Now then, the vaccine works. It prevents serious illness and helps prevent transmission. But I'm reading in the papers this morning that even if you've had 2 jabs and you come into contact with somebody who's a positive case, then after the 21st of June, you will still have to isolate for 10 days. So could my right honourable friend please confirm whether or not this is correct?
I'm grateful for my honourable friend, and I answered a question earlier on this issue. And obviously, if you contract COVID, then you have to isolate and quarantine. But those contacts, we are looking at regular testing to see whether there is an alternative. But he'll, I'm afraid, have to wait till a little longer before step 4, when we'll be saying more on this on the 14th of June.
Thank you, Mr. Speaker, and it's a pleasure to be back in the chamber. But for many, like me, who are immunocompromised, returning in person to the workplace is concerning, as we do not yet know how effective the vaccines are for us. So would the Minister consider allowing immunocompromised people to have access to antibody testing, thereby giving us some idea of the vaccine's efficacy and some knowledge of our level of protection from the virus?
I'm grateful to my the honourable lady for her question, and she asked a similar question last week, and the Professor Harrington of the JCVI actually did come back on the antibody testing as saying that the problem with it is, what does it really tell you? But I'll happily ask the question again on her behalf of the JCVI. Suffice to say, on the 17th of May, Mr. Speaker, we also put out guidance to employers to make sure that those who are shielding, who are immunocompromised, should be allowed to work from home if they need to.
Chris Green.
Thank you, Mr. Speaker. Would my honourable friend confirm that the government's position on the coronavirus pandemic is it's still a question of life and death? Also, that communications are vital in this effort, and that compliance follows confidence, which in turn follows competence. Will he confirm when these local lockdown measures were agreed with the leadership at Bolton Council? Will he confirm when the Prime Minister formally agreed this updated guidance being imposed?
I'm grateful to my honourable friend's question. He will recall that the Prime Minister on the 14th actually addressed this issue yes, he did, absolutely did address this issue in his press conference. And I can read him the words from the 14th of May press conference, because he, from a sedentary position, he did not. He promises, I think we have to exercise with this new variant the risk of extra transmissibility. I would urge people, and we were speaking about obviously Bolton at the time, just to think twice about that. That's what we're saying. I think that we want people in those areas to recognise that there is extra risk and extra disruption, a threat of disruption to progress caused by this new variant, and just to exercise their discretion and judgment in a way I'm sure that they have been throughout this pandemic and will continue to do so. And I hope very much, that they do so very much. Those were his words, and the guidance was there in place.
Thank you, Mr. Deputy Speaker. I think this minister has. Thank you, Mr. Speaker. I apologise. Thank you, Mr. Speaker. The minister, I think, has done a good job on the vaccines, but this statement is utterly chaotic. It is completely confused what advice he is actually giving to people in the Northwest or people in West Yorkshire about going to the pub, about weddings, about travel, even about whether or not, if they're allowed to travel out of Bolton, are they allowed to travel to Portugal on the green list for holidays or not? Isn't the reality that the reason he is so uncomfortable about giving any advice is because he knows the reason that he is putting these people in Bolton, in West Yorkshire, and other places in this position is
because the government failed to put India on the red list earlier, because over 400 people from India came with the India variant into this country, and their rules prevented that spreading to thousands of other people in the community. Will he apologise to people in the areas that are affected for the additional restrictions he is advising them to take now because of the government's failure?
Yeah. I'm grateful for the right honourable lady's question, and I don't agree with her. She won't be surprised for me to say that, because I've already talked about how visiting families are impacted, pubs and hospitality are affected, and the exercise of caution and being careful. She will recall that on the 23rd of April, when India was put on the red list, it was a full 6 days later that that particular variant was identified by the experts, the virologists, as a variant of interest. And a full 2 weeks later, it became a variant of concern. So her point actually is made unfair.
Thank you, Mr. Speaker. Will my honourable friend confirm when he anticipates that the NHS smartphone app will be enabled to allow those in Wales to demonstrate their COVID vaccination status? And further to that, does he expect that other features of the app, such as the ability to book GP appointments, to order prescriptions and to view notes, will also be enabled in Wales?
I'm grateful for my honourable friend's question. We are working closely, Mr. Speaker, with the Welsh Government to enable the integration of the Welsh citizens' data with the NHS app, nhs.uk, channels for the purpose of obviously COVID status certification, including undertaking the sort of required scoping and, of course, impact assessment, which will enable us to set out a detailed timeline for that delivery of integration.
We now go to Dr. Luke Evans. Luke.
Thank you, Mr. Speaker. And the people of Bosworth are a pragmatic bunch, as are the people of Leicestershire. Leicestershire surrounds Leicester. So the question I have is, what does the advice does the Minister give for those people who are in Leicestershire, who send their kids to school in Leicester, who work in Leicester, and who are thinking of having bank holiday time with family in Leicester?
I thank my honourable friend for that question, and I hear the honourable member say, from a senator, a good question. He's absolutely right. They have to exercise caution and common sense, as I described in my earlier remark around visiting. They absolutely can visit family and friends in half-term if they follow social distancing guidelines. It is that personal responsibility that people, that common sense that people will, I think, absolutely exercise when they go about their family time or school time.
Thank you, Mr. Speaker. Last year, the Prime Minister gave in to pressure from trade unions and cross-party opposition and announced refunds for health and care workers from overseas for the £624 charge they are paid to use the NHS. Yesterday, the Minister of State couldn't tell me how many healthcare workers had been refunded. At committee earlier today, the Care Minister didn't know either. Does this Minister know how many, if any, healthcare heroes have had their NHS charges refunded, or was it just another empty promise from this government?
I'm grateful for the honourable member's question. I'm happy to write to her with the answer. But suffice to say, it's an important question, an important amount of money to those people. And I don't think we should be playing politics with it in a sort of gotcha moment.
Esther McVeigh.
Thank you, Mr. Speaker. The Minister will recall that we were told that the first lockdown was required to give time to build capacity within the NHS. Can the Minister therefore tell us how many more hospital beds are now available than compared to March last year?
I'm grateful to the honourable lady. I will write to her with that detail. Suffice to say, obviously, as I said in my opening remarks, we now have 908 people with COVID, the lowest since lockdown.
Emma Lewell.
Thank you very much, Mr. Speaker. South Shields and North Tyneside are interconnected. Today, my community and businesses are incredibly anxious. We know that local lockdowns don't work and inevitably lead to national ones. We know it is likely there will be other variants of this virus and it may well be with us forever. Lockdowns break our economy and society, cause mental distress, delay vital cancer treatments, lead to further unemployment and exacerbate inequalities. Instead of, for example, fixing test, trace and isolate, Can he explain why the government's response is always more restrictions and endless cycles of lockdowns?
I hope she agrees that the vaccination programme has given us a way out of the non-pharmaceutical interventions, which is the only thing we had at our disposal to try and slow down this pandemic and this virus. And where I would hope we can both agree that as we transition from pandemic to endemic, obviously there is the autumn, and we were planning for a booster shot to protect the most vulnerable, or all phase one. That clinical decision has to be made yet. And then, of course, next year, we are already making plans for us to be able to deal with COVID in the way we deal with flu, seasonal flu, in terms of annual vaccination programs. By next year, this country will be able to manufacture 700 million doses of vaccine, not just for the UK, but to also help the rest of the world.
Thank you. My Colne Valley constituency is in Kirklees. Now, I could ask about how the new travel advice for Kirklees was communicated to my constituents, but instead, Mr. Speaker, I just want to clarify 3 things with the Minister. Firstly, travel advice. We're coming up to half term next week. Families will be visiting and going on short breaks. Should they now cancel those trips? Secondly, hotels, B&Bs, restaurants are getting cancellations. What support will hospitality get? And finally, Mr. Speaker, my constituents can see the data, where the hotspots are. When are we going to start using granular data to tackle the outbreaks rather than lumping whole council areas into these advised restrictions?
Thank you very much, Mr. Speaker. Let me try and take those in reverse. So on the granular data, we already, in the vaccination programme, have the capability to be able to see literally by postcode area where the uptake is at, and that's how we are able to focus our resources to be able to turbocharge the vaccination programme, as we have done and will continue to do, including in Kirklees. On pubs and hospitality, indoor areas at hospitality venues can continue to serve, and as I described earlier, of course, serve seated clientele and diners and drinkers. And of course, if they families have book visits to families, then they are absolutely able to visit family, as long as they follow those social distancing guidelines and that common sense. We need to make sure we are vigilant, because this B1617.2 variant is something that is concerning us, and we have to bring it under control by turbocharging vaccination, surge testing, isolating, and of course genome sequencing.
Thank you very much, Mr. Speaker. And can I agree with the question that my honourable friend just said? What we need now more than ever before is very clear communications from the government, so residents in Burnley, in Blackburn, in Bolton know exactly what's expected of them. So could the Minister just confirm that this guidance is guidance, and my constituents can still exercise the freedoms that they reclaimed last Monday? And I also ask that he meets with me and other colleagues to talk through what more we can do to make sure this communication is clear in the areas where we need it most.
I'm very happy to meet with my honourable friend, and as I have made clear, I think, on a number of occasions at this dispatch box, in terms of the guidance, people have to be careful, have to be vigilant. They've done that already. A number of colleagues have asked me about the Batley and Spend by-election. We've just demonstrated in the local elections that we can conduct elections safely, and we'll be able to conduct that by-election safely too. So they need to just be sensible. Let's work together. Let's bring this together, and let's take the politics out of it.
I'm now suspending the House for 3 minutes to enable necessary arrangements to be made for the next business. Order.